Hey guys, what's up? Sam from the Repro Vets, and we are here today with a palate reduction surgery. Wanted to show you a little bit about the nuts and bolts of what we do on this. We've got our patient here that's prepped and ready, and want to go through some basics of what we're doing. So we always have an IV catheter placed in these guys to make sure that we have access, venous access, should an emergency arise. A little bit about the setup. We're maintaining on isoflurane. We induced with a pre-med of acepromazine and an induction with ketamine and midazolam, and then maintain on ISO. Setup for this palate surgery. It's really handy to have a method to hold the patient's head up a little. It is imperative when you do that the dog has an endotracheal tube passed and that this cuff is inflated. And so you do not want any of the blood or seepage to go into the trachea to cause any sort of aspiration issue. After that, it's going to come down to marking where we reduce this palate to and go from there. So I'm going to turn the camera around and show you that. Okay, once again, we're back, and this is one of the most complicated surgeries to video that you'll probably ever see. But a little bit about the anatomy for those of you guys that are not veterinarians. The harder part of the surface of the top of the mouth is called the hard palate. Back here in the back, this is very soft tissue. This is the soft palate, and this is what we're going to resect. And a little bit about how you know where to do it. The first thing we want to do is check where the epiglottis, which is going to be at the back part, is a triangular shaped thing right here at the bottom. We want to see where that epiglottis touches the soft palate. And so to do that, we're going to remove the tube, and we're going to come up here and see where does that epiglottis touch that, because we want to resect this soft palate right where the epiglottis touches the tip of the soft palate. So we're going to get that out and get the tube out and start that with the video here in just a second. Okay, so here we are. We've got our carbon dioxide laser, and we're ready to mark this palate. And this one is not too far off. This one actually has been done before, but it's a little uneven. And what we've got is you can kind of hear and see the snoring. This soft palate is getting over that epiglottis, and it's rattling as she breathes. So we're going to take our surgical laser, and we're going to basically make little bitty small marks right where we want this soft palate to come off, and it's just little dots. It's kind of connect the dots when we go to connect to shortening this palate with the laser. So we're going to make a little line across there, and you probably can't see that, but what I've done is made a series of dots there across the soft palate where we're going to resect that out. Be right back. Okay guys, so a couple things about what we've done so far. The first thing we did is we took a very damp gauze, and we have connected it to just an Alice tissue forceps. Just in case the dog swallows, we don't want it to swallow the gauze. And so we've got this particular Alice tissue forceps right here is connected to the white gauze down there that is damp. The reason we do that, we're using a CO2 laser. We do not want to accidentally poke a hole through the endotracheal tube where there could be some flammable oxygen, and that could be catastrophic. And so the next thing we did is we took Alice tissue forceps, and remember, we're never going to hardly use these instruments, but this is a great spot for these, because any of the tissue that you're going to clamp that on has to be removed. So we're going to try to zoom in just a little bit and show you. You can see our dot to dots in the back, and try to zoom in right quick and see if you can see those. Yeah, you can see the dots that run right above where we're going to do that. That's where we're going to take this palate off at. And so what we're going to do is take the CO2 laser, and we're going to start on one edge and just start working our way across the dotted line to remove that section of the palate. guys, there we have it. You know, we got the finished product there. We're going to zoom in a little bit and show you real close kind of what we're dealing with. It looks much, much better. We're talking a lot shorter, a lot more open of an airway where this dog can move air, you know, in and out. Let me shut off the vacuum here. So yeah, much more open airway. This dog can move air a whole lot easier with a whole lot less stridor when it's breathing. And so that ought to help this dog out a ton. So there you have it. That's a soft palate resection. Okay guys, so yeah, that wrapped it up. That's a soft palate resection. I wanted to point out two key things. One is this dog has had this before. They didn't do quite enough of it. And so there's two other procedures that go hand in hand with this. Especially with the CO2 laser, you can really, these dogs can really benefit from stenotic nair opening. It's something we've already done with this girl, and so I'm going to show you real quick her nairs. You can see the nairs are the nose, and it's these little flaps that stick out right there. We can open those up tremendously with the laser. This dog's actually had it done, and it could probably maybe take a little more, but they're adequate for me, and those dogs can move that. The other thing is, beside the soft palate, there are what they call laryngeal saccules. They're basically tonsils and little lymph nodes, and they live on both sides of that of the epiglottis on the side of the throat. Dogs that have difficulty breathing, those get inflamed and they'll actually pop out. And so, you know, when you see that, we want to remove those. And so we'll try to get that in a future video, but I just wanted to show you kind of what an elongated soft palate resection looks like. And that's it for the day. Thanks for watching. Hit subscribe.